Hello. All right.
Hi,
Well, you guys are with one of the clinics. Do you guys want to go ahead and introduce yourselves?
I'm Shelley Harrington from the Rock County Clinic in Bassett and hospital and long-term care as well.
And I'm Crystal Daly, same.
All right. Well, I just have a few questions for you guys. So, what are you seeing in your facility currently in regards to COVID?
We've definitely seen an increase in the number of positive cases over the past several weeks, which also tasks the nursing staff and hospital staff quite a bit. I say that we've probably seen increased admissions with COVID-19 as well. And then definitely difficulties with getting patients to higher levels of care.
Right. Yeah, that is a huge concern right now, especially in all of our facilities around the area.
Yeah.
And what would you say, or how does this year look different compared to last year at this time?
I honestly think, we have the availability of the monoclonal antibody, which we didn't necessarily have a year ago. It's been around for a little bit, but we're definitely giving a lot more of that. So I think that's a positive that we have that available. But again, just seeing the uptick in the need for that and the number of infusions we're giving of those doses. And I would just definitely say we're seeing a lot of numbers, high numbers again, that maybe I'm not sure where we compare to a year ago, but it seems like a lot right now.
Do you want to explain a little bit on the monoclonal process? Like what qualifies someone to get it? And then what's the process if they do need to receive it? How does that go?
Sure. So if people just come in and get tested, that's kind of one of the main things. First of all, you have to have COVID, but then there's a few requirements to make you high risk. And one of them really that qualifies almost anybody is just a BMI greater than 25. And that's not very much. You don't have to really hardly even be overweight at all. And some people you wouldn't consider overweight at all, but their BMI does meet that 25, which allows them to get the monoclonal antibody. Chronic kidney disease, diabetes, immunosuppressive disease, and anybody over 65 for sure. But the real thing, like I said, is come in, get tested, and talk to us. And we're really pushing people to get it because I do think it's definitely decreased the number of hospitalizations or people getting sicker and showing that decline. So.
I think the frustrating piece of it, though, is that we still have a lot of people that are sick and they don't come in to be tested. They don't even know that there's treatment available. And so those people have already declined significantly enough that we can't offer that as a treatment and end up hospitalized. So oftentimes I remind people that we see in the clinic and even through the emergency room, like if you get sick or you know someone who's sick, please tell them to call the clinic. Please tell them to come in, because I think that there is a lot of hospital admissions that could have been avoided if we were able to use this.
And even if it's not COVID and it's the flu or something else, it would always be good to go in and get that checked out. Make sure you're not spreading anything else around too. There's a lot of other stuff continuing to go around.
Yeah, absolutely.
Right. Okay, my final question is, what is your advice that you have for your community to keep safe?
Be aware of your surroundings. Mask if you are, in an indoor place where there's multiple people around. Get vaccinated. Yes, we are seeing some people who've had the vaccine who are testing positive, but we've had 80-some-year-olds who are otherwise quite unhealthy who don't really get very sick if they've been vaccinated. So number one, get vaccinated. And number two, like I said, if you're showing any symptoms, come get tested so we can give that monoclonal antibody. And the sooner we can treat you, the better the odds are. So, and just to be upfront and honest with the mask wearing, I think as far as school systems go, if there's, if you've had close contact with someone and you've been notified, please wear a mask and just, do our best to keep students and staff in school and keep this from spreading otherwise unnecessarily. So.
And one of the things that I think we talked about early on in the pandemic was thinking about other people. People seem generally tired of COVID, angry about COVID, angry about vaccination, but we're still forgetting about who we are and that we really do care about others. And sometimes we put our own needs and our own wants in front of the fact that we could be making someone else ill. And those are the situations that are very difficult when you have someone who is very sick and probably shouldn't be, and maybe was exposed or unknowingly exposed by someone who wasn't taking responsibility for themselves.
Right. All right. Is there anything else you'd like to share?
Just call your healthcare provider if you have any questions. Everybody's, well versed in what's going on right now and willing to help anybody out. So,
Yes, for sure.
Yes.
All right. Well, thank you guys so much for coming on.
Thank you.